Well, as folks are filtering in, I think we're going to get started. We are really excited that you are here. Thank you for joining us. It's been a really energizing and exciting day to be talking about forms. It's one of our favorite things at Sevilla. We've spent the past decade plus working on improving and designing forms. So we love to be among our people and having the chance to, both learn from others and share more about the work that we're doing and what we're learning along the way. Today, we're going to be talking about tracking forms. So essentially, once you submit a form, what happens next? And the work that we have done in Michigan to build the first digital benefits tracker in the country. We'll be kind of pulling back the curtain on that case study and sharing both the impact of that work, but also what was learned along the way, and hopefully leave you with some useful lessons on things that you could apply to your own work as well. We wanted to spend just a little bit of time introducing ourselves. We have three members from our team here. My name is Lena. I'm the co-founder and COO at Sevilla. I'm here with my colleagues, Gabby and Sam. So I'll kick it over to them to introduce themselves as well.
Hey everyone, I'm Gabby Durantes, one of the design directors at Sevilla over the Health and Human Services portfolio. I'm really excited to have you all here today, talk about forms, and I'll pass it over to Sam.
Hey everyone, great to see everyone in the chat. I'm also a design director with the team here at Sevilla and excited for the questions and discussion.
Great. So we just wanted to share, before we jump in, a little bit more about who we are. The three of us are here today sharing this work, but there's a much larger team that's contributed to this work behind the scenes. So we wanted to make sure to not skip over the role that they've played. We are a nonprofit organization based in Detroit, Michigan, dedicated to changing the way our public serving institutions work through human-centered design. So we're based in Michigan, but do work here and nationally. Our deep keel is in human-centered design. We primarily work with government agencies, state agencies on improving public benefits delivery, unemployment insurance. We've done work with the Department of State and the child welfare system as well. And when we talk about human-centered design, we often use this image to describe what we mean by that. We call this the person on the path. And as institutions, we see this a lot. We often design around our own needs, right? We get clear on what the problem is. We research the best practices. We buy the bricks. We lay them in. We announce a new program or service. And then we watch what happens, and we start to see this happen, which is that people often don't use those programs or services or solutions as intended. And instead, we learn that systems don't meet their reality and people cut their own priority paths. This happens quite literally out in the world. So if similar to this photo, you can start to notice these shortcut paths in physical space, but also metaphorically. If you think about the last time you tried to, file for health insurance or navigate public transit or apply for a passport, those experiences often don't feel designed around your needs. They feel like they were designed with an institutional lens instead. And so, we spend a lot of time working with leaders to help them understand this and to partner with them to get closer to the people at the center of this work. Because if we had, there's a lot of benefits on the other side, right? In this case, what would have happened if we'd gotten closer to the user and their needs? We would have had a shorter path. It would have been more direct, less expensive, more enduring, more trusted, and likely less expensive to build. And so we are really passionate about working with government agencies to help them link arms with community members and frontline staff in order to design solutions that work better for everyone. With that, each project that we take on is different, but often at a high level, it involves three phases of work. And we're going to walk through each of these phases and what it looked like in the case study that we'll walk through today. The work often starts with deep research. So this is quantitative and qualitative research focused on really understanding people's needs and identifying the biggest opportunities to change. We then step into design and testing. So using human-centered design, we take an iterative process to design alongside the personal path and reshape services from end to end to make sure they really meet people's needs. And then we step into the really important and often grueling work inside of institutions of implementation. And this is working with policy and communications and training departments and political figures in order to implement solutions at scale and make sure that the process remains human-centered from end to end as we do that. So we'll keep these 3 phases in mind as we walk through the case study that we're going to jump into in a much deeper way together today. With that, we're going to step into, like we mentioned, a case study from our work in Michigan. And this was focused on redesigning the country's first benefits application tracker. From the time that we've spent in this space, there's been a lot of conversation about trackers over the years. They're something that, often is fairly easy to imagine, but actually can be a lot harder to implement. So as we go through today, we'll talk about what some of those sticking points were and how the team got around the challenges related to implementation to bring this vision to life. And as we go through, we'd really encourage you to listen for and make note of the role that user voices played in this process, or the voices of the person on the path, both in shaping the solution itself, but also in making the case for change, because there's importance on both of those things. So with that, I would encourage you to take out a pencil and a piece of paper, or digital notes if that's how you prefer. And I'm going to kick it over to Gabby, who's going to share how this work started and the people and voices that were really central to bringing it to life.
Thanks, Lena. Yeah, so our focus was to improve access for over 2.5 million residents who access public benefits each year in Michigan. And when we say public benefits, we're referring to the state's 5 largest programs, which include food assistance, healthcare, childcare assistance, and cash assistance. We'd spent many years redesigning the application form for benefits for both online and on paper for Michigan. But one of the questions that came up once that redesign had happened was, once you submit your form, what happens next? And so in this work, it's really easy to jump into institutional considerations like the design patterns that are needed, policy needs, technical infrastructure, things that we've heard a lot about today. That's really important work that needs to happen. But one of the things that we really believe in is not forgetting that in the end, it's the voices of real people in the context of their lives that should be guiding this work. And so in the spirit of true human-centered design, we started off with research and spent time sitting down with the people who were closest to it. These are the residents that were applying for benefits in the state of Michigan. We were able to meet them in offices as they were waiting to apply, or as they were there with questions for intercept interviews, as well as for long-form interviews to better understand their needs and stories. Our research also extended to community navigators, so those outside of the state offices who often work to help residents navigate the process. They usually have a wider sense of the challenges that people face, since they're leaned on as a trusted partner from community members, and they're often consulted when they're encountering difficulties or have questions through the application process. The conversations and voices were really important in shaping the solution itself, but also in making the case for change. And this is why the research part is so important. In our research, we met a range of people who gave us insights into the experiences that they were having. We met people like Lauren, who's an experienced benefits recipient. Lauren shared with us that she was working multiple jobs in both hospitality and as a secretary. She uses MI Bridges, which is Michigan's online benefits portal, as a way for her to stay on top of her benefits and manage them. She really prides herself in doing all that she can to prepare in advance for what comes next in all parts of her life. And so despite her experience navigating benefits, she described feeling anxiety and worry regarding the uncertainty about next steps with her application. She still experienced misinformation and communication challenges with caseworkers and paperwork during her most recent interview process. She shared, people want to know what their application, that it's not lost in a pile of 1,000 other applications, that it has been seen. It's hard to know if there's a next step or not without reaching out to a caseworker. And unfortunately, Lauren's experience was not unique. We've heard many other residents share similarly. We spoke to another resident, James, who is actually newer to the process. He's an MDHHS client in a small town in Michigan, and he recalled his recent experience applying for benefits for the first time. At the time that he applied, he had overdue bills that he needed to pay, and his friend encouraged him to apply for energy assistance in Michigan. But once he applied, he experienced a lot of worry and confusion during the process, and ultimately he was denied. James shared with us, I want to be sure I'm doing the right thing. I was denied because I probably made a mistake, but it was out of nervousness. If I did something wrong in my process, I want to know what it is. To this day, James is actually not sure what he did wrong, but his experience was pretty similar to that of Lawrence. They both wanted to do things correctly. They thought they followed the right steps, but the uncertainty around the process led them to worry. And in James's case, it led him to blame himself. In hearing from residents, it also felt important to understand what was happening on the other side of the desk. And this is something we really want to emphasize when thinking about the person on the path. In institutional systems, we often talk about designing for two sides of the coin. So, both people in the community who are accessing services, as well as frontline staff who are supporting them through the process every day. What we found is that if solutions are designed to only work for one or the other, they're not going to succeed in the long term. So in Michigan, we spend time in lobbies alongside health and human services navigators who are often the first touch point for residents when they're coming in with questions seeking help. We wanted to understand what some of those common questions and concerns were. We also sat down with caseworkers. They're the ones that many times are fielding the phone calls from clients so that we could understand the experience that they were having and what they were confused about. What workers shared is that they were very familiar with the feelings of confusion and anxiety that residents had shared with us. Unfortunately, that confusion is leading directly to increased workload for caseworker. In Michigan alone, the Department of Health and Human Services, they receive over 8 million calls annually, and that doesn't include the help desk questions. Staff told us that the questions they hear every day are related to, did you get my application? Did it come in? My worker didn't call. What should I do? When can I expect to hear back? When will my benefits be turned on? Is there anything else that I need to do? In the end, we landed on a clear insight from all of these conversations, which was after residents submit an application or a form, they're met with an opaque process. There's uncertainty about what comes next, when it's going to take place, and what to expect really creates a lot of anxiety. This leads to more phone calls, office visits, and procedural denials. Our sense is that this isn't unique to Michigan or public benefits delivery. In any system that requires an application or a form, there's likely a similar desire for transparency about what comes next in the process. So the question became, how do you solve around that? So I'm going to pass it over to Lena, and she'll actually share more about the design and testing and implementation phases.
Thanks, Gabby. Yeah, so from there, we moved out of the research phase and into the design and testing work. And in this specific case, we actually started with what we call analogous inspiration. So that is looking at potential solution spaces or ideas that don't reside within the specific topic area that you are looking at, but could provide, inspiration for new ideas that hadn't been considered. And one of the things that had come up a lot in conversations over the 10 years that we've been doing this work in benefits delivery is the Domino's Pizza Tracker. People love the Domino's Pizza Tracker. It is, quite a delightful experience for customers. And obviously, this is not benefits related, but as we were hearing stories related to the lack of transparency in these systems and the desire to be able to track where an application in this case or forms are in the process, there was a lot to appreciate actually about this design that could be relevant in a government or in a benefits context. A few things that this inspired for us or that felt relevant to pull the thread on. One is it brings transparency to an otherwise opaque process, right? So rather than keeping customers in the dark, this is a tool that helps people understand what comes next and where they stand in line. It also describes the major steps of the process. Obviously, in this case, it's describing the next steps of the process in receiving your pizza, but you could imagine what are the next steps in the process for receiving your benefits or another service that you're offering after submitting a form. And so we started to imagine things like how might we give visibility to things that come up next, like completing an interview or submitting documents that are required. We also started to ask questions about how do we provide details on each step. So, for example, how to prepare for an interview or what documents are required that would help people be more likely to succeed in the process that they were in. And timelines came up for us as we were talking with residents. They have a strong desire to know when certain steps are going to occur. And obviously, we don't want to overpromise. There's often, inconsistency in when certain determinations are made, but it had us starting to ask questions about how we could alleviate some of that anxiety while people were waiting. So I think aside to its applicability to this specific process or project, the pizza tracker was a really good reminder, I think, for us of the value and insight that can be generated by stepping outside of our own silos. And often the challenges that we're navigating are shared among others. There's a lot of inspiration and wisdom that exists in other spaces, even in the private sector. And so, it was just a good reminder of how do we start to stretch our imaginations beyond the bubbles that we work within and then pull it back in to ultimately benefit the work that we are responsible for. Seeing lots of love for the Domino's Pizza Tracker in the chat. So from there, with that in mind, we started to step into concept sketches about, what could this look like in our specific context. We started like this with literal Sharpie sketches on a whiteboard that allowed us to start to explore and test out ideas quickly and get feedback before too heavily. And from that, there was a lot of value that came from those early sketches. And most importantly, we got a lot of learning related to what milestones would be most helpful to orient the tracker around. And so in this specific case, those milestones were people wanting to see that the application or form that they'd submitted was received and registered in the state system. Second, that if they had an appointment, that was scheduled. Often this was for an interview for programs like food assistance. Third, if documents were required, folks wanted to know, what documents do I need to upload, things like pay stubs. And then the last is they wanted to know when eligibility had been determined and if they were either approved or denied. Similarly to the tracker, the Domino's Pizza Tracker, our sense is that these are actually likely milestones that are transferable to other contexts. So if you're thinking about building a tracker for your own context or forms, the question should really be, what are the milestones in that user journey after someone submits their form, and how might you give visibility of progress as people move forward? In our work, once we aligned on those primary milestones, we then move to higher fidelity mockups. So we use the existing design patterns within the MyBridges portal, which is the benefits portal in Michigan that had been operating for many years. We then brought different versions out into the field for user testing in order to get feedback from residents and make improvements based on their needs. And here you'll see just examples of on Post-it notes of feedback that we got on different versions of the tracker. This was also a good reminder for us that no matter how many years you've spent designing in the systems you're working in, there's always value in user testing. There's always something to be learned by bringing things out into community and really listening to the people who will be closest to it. And ultimately in this process, it was people out in community and frontline staff that shaped the design of what got built. That led us to final designs for the benefits tracker. Every element in these in the final designs were guided by user feedback, from the content itself to the visual design. And many of the lessons here, I think, are transferable to others who are thinking about tracker designs. A few things that we would call out with regards to the content itself. One was just the importance of celebrating progress. So in this particular case, a client had applied for 2 benefits at the same time, healthcare and food. The healthcare got approved. There were still some next steps for food assistance, but we wanted to make sure to not skip over the progress of getting approved for one of those benefits. And we heard from clients that was very appreciated, given how difficult and anxiety-provoking some of these processes can be. The second was just really needing to make sure to confirm that the application was received. Like Gabby mentioned, of all those millions of calls a year, a lot of them are just like, did you get my stuff? Did it get received? And so the more you can just give confirmation that it was received and registered in the state system, the better. Next is providing clear next steps. So beyond it just being received, giving clients or residents a sense of what comes next. was really appreciated. For example, in this case, needing to complete an interview. And then within that, only listing key details. So we heard from residents that details are helpful, but they didn't want it to clutter up the experience of the tracker too much. And so in this case, the key details were just the date and time that the interview was scheduled, and then the ability for them to click in to view more details, which was a design pattern that we found very helpful in the tracker itself. And then the last is where possible, provide timelines without overpromising. So like we mentioned, we weren't able to estimate for every case exactly when it would be determined, but there is something called a standard of promptness in benefits delivery, which is the latest possible date that people should expect to get a determination. And so we list that here in the tracker so that folks know that if it goes beyond that date, something might be wrong and they might need to, reach out to caseworkers or the state to see what might be up. Visually, there was also a lot of input received by residents that was helpful. One thing that we heard really clearly is that folks wanted check marks to indicate that a step was completed. The gray circles indicated current or future steps. And then that blue line on the left-hand side kind of shows this forward progress and helped them feel like there was momentum. And so this simple visual just made it clear to residents at a glance what steps were completed, where they were currently, and what needed to come up next. So once the design work was completed, there was a lot of work that needed to happen on the implementation side to make it feasible. And this is really where the rubber meets the road for trackers, especially. So we want to talk about some of these key aspects of the work, and then we can also talk about where the opportunities exist to make improvements, both from what we've seen in Michigan and then also more widely. I think policy and legal in the context of government services is a big one. And so in this particular case, there was a lot of coordination that needed to happen across policy and legal teams to ensure that the designs met the programmatic needs. There were 5 core programs that were incorporated into this tracker: healthcare, food assistance, cash assistance, childcare, and emergency relief. Each of them have their own policy requirements. And so bringing those teams along earlier rather than later and making sure that we're designing alongside them was important. The second, and this was a big one for the tracker specifically, is technical. So in the case of Michigan, they developed a new API that allowed critical information to be pulled from the back end to the front end without impacting system performance. And we'll talk more about this, but this is a really big consideration if you're thinking about a tracker, is really understanding what's possible based on the data that's available in order to then inform what can be displayed on the front end for users. And then the last big piece was communication. And before rolling this out, it was really important to engage frontline staff and community partners to let them know what was coming in the tracker, what was available there. And as they started getting questions from residents who might not have been aware of the new tracker, starting to point them increasingly online so that they could start to self-service more often rather than continuing to call or visit an office if they could find what they needed there. So I think questions for you to consider if you're thinking about rolling out a similar tracker here is, on the policy side, asking who needs to be involved and sign off and engaging them sooner rather than later. On the technical side, asking how is data structured for the program or service that you're designing a form around, and what data is available to pull. And then on the training side and communication, who needs to be informed prior to rollout to make your work successful. From there, we ended up launching in Michigan, which was a really exciting moment. It was ultimately the first state in the nation to offer an application tracker of its kind for public benefits. And we saw really quickly in the data the impact that it had on residents. And we were seeing that within, early rollout, we were starting to see in the first week 60,000 users a week, as well as a 14% drop in calls shortly after launch. These numbers obviously have changed over time as people become more accustomed to using it. We also heard from the stories themselves that it was meaningful for residents. So we heard things like, before, it was really hard to know if there was a next step or not without reaching out. I don't feel like I need to call a caseworker any longer. And that for us was just as important as the impact we were hearing and seeing in the numbers, given that this work was really guided by and intended to be a benefit to community members who are struggling to navigate this previously. There were a number of recommendations and learnings over time that we would encourage people to think about if you are also considering building a similar tracker for forms or applications that you're administering. I think the first one, and this is something that is before the work would begin, but would be encouraging everyone to build for mobile first. So most residents these days are accessing public services on their phones. So designing the tracker to be mobile first ensures that it's as accessible as possible for residents. I think before beginning, it's helpful to assess the usability of your current system. In the case of Michigan, the My Bridges portal had a lot of user-friendly and updated design patterns, so we knew that we could design within that system and have it go well. You might be designing in a more dated system, and if that's the case, it might be an opportunity to begin to set a new design standard that actually you could then roll further into the service over time. So whether you use existing design patterns or new design patterns, I think would be a question based on how updated your current system is. The second thing that has come up a lot is just ensuring ease of access with a user-friendly login experience. And this sounds basic, but it's not. Unfortunately, in government services, the tracker is only as useful as people can access it. And in the case of Michigan, because there's a lot of personal data wrapped up around benefits, people had to both log in to the system and proof their identity proof in order to use the tracker. And if that process is confusing, then it limits how helpful this service is. And so something we would encourage for folks who are thinking about building a tracker is to also think about the ease of use of the system around it, especially related to logins, and make sure that there's work being done to improve the accessibility of those systems at the same time. A third and really big one is we just heard again and again from residents, provide as much detailed information as you can to build trust and reduce calls and visits. This is easy to say and a lot harder to do because it really depends on what data is available. But if you're only able to tell a resident that an application is processing or it stays on that step for a long time without providing more granular progress, people start to lose trust and will likely start to call centers again or visit offices. And so you don't have to have it all from day one. So in Michigan, there have been limitations to how much data is available to provide details here. But if that's a challenge, we'd encourage you to identify what's kind of the minimum viable product that's available based on your data right now, and then plan to improve it over time, right? You can design with the end game in mind and then kind of walk it back and implement in a more iterative way. And then the last thing related to that is investing in strong data practices so that the backend and the front end systems align. Being able to deliver that detail really depends on what data is available. And so you want to start with a strong understanding of what data is available today and how you could then improve that moving forward so you can provide more and more granular input for residents as their case moves along in the process. So those are a number of recommendations, I think, that and learnings that have come from this work that we'd encourage you all to think about as well. I think on reflection, one thing we've seen since rolling this out is just how critical a tool trackers can be in providing transparency in an otherwise opaque process. We really have heard from residents that it helps them feel like we're all on the same side and we're helping them succeed in this process. And we really feel like they're worthy of more attention and investment in the wider ecosystem as we're thinking about forms broadly. And with that, would just leave a couple minutes here before we start Q&A for reflection. But if you're here at FormFest, you most likely have either forms of your own that you're working to redesign or partners that you're helping redesign forms. And so it's worth asking and having you reflect for just a minute. What is a form that you are administering today? How might you bring greater transparency to that process after it's submitted? And what role can the user voice play in shaping that solution as well as for making the case for change? So we'll take just a couple minutes for everyone to reflect on that as it relates to your own work. And then we're going to roll into Q&A. So we will have folks put their questions in the Q&A tab up in the chat. And we'll start to just open it up more broadly. take one more minute of reflection. And then if you want to move over to the Q&A tab, we'll start to pull questions out of there for Q&A. Lots of good things coming in. So I think we'll just start to take it as we go. And we also are here with our teammate, Sam, who wasn't participating in the presentation, but he was on the ground doing the work itself. So he might address a number of these questions through Q&A because he lived it and breathed it for a long time. I think we can start first, Gabby, with this question related to, can you show again what the dashboard looks like? I saw that the approval cards could be dismissed. If I accidentally clicked it, can you still view it elsewhere? So if you want to go back to, I think that the final mock-ups. And Sam, I'm curious here from the final designs, I think they're referring to that X on the top right. Does that ultimately delete the card, or does that just like fold that?
I don't know if I don't know the status on like implementation, but I know in the designs there was like a post, like applications who approved applications, you could go back to look at details like that. There were separate cards for those in a separate location.
Yeah, and it's folded into a larger functionality within my bridges called View Benefits. So you'll see a link to that on this card, but there's a page you can go to look at all of your current benefits. And so folks will just start to manage it at that page. But great question. There's another question here, Sam. This is a big one, I think, for you. Curious if in creating the tracker, the data you needed was already available and easily accessible via API, or if you had to work through additional data needs. There was a lot of work here. Do you want to speak to that a bit?
Yeah, as best I can. I think there were pieces that we knew were already available, and so like even some of those like 4 main stops, we knew that there was things that the department was going to be able to pull on to be able to pull that into the tracker. But I can't fully speak to all. I mean, they did. It was months and months of work on the back end to get it to the place it is today. So there was additional data needs that they definitely needed to continue to push on in order for that to be viable.
Yeah, and the API had not existed prior. That was created to help implement this, and I think has been used more widely for other functionality now too. But this project really like spurred the creation of that API so that they could call up more helpful data from the back end in order to display it for residents to see. Brendan. Hi, Brendan. Good to see you. He asks, the staff is often overwhelmed, which leads to residents needing status. What are quick wins to help overwhelmed staff and gain trust? Gabby or Sam, what would you say for that? It's a big question.
I don't know about quick wins, but other things that we've seen help in this process is being as clear as possible in all the communication. So in the letters that are being sent out, in the signage in the offices, and what workers are communicating, just setting the expectation. So in this case, oftentimes clients are getting a decision before the standard of promptness is due. But a lot of them just are unaware of when that standard of promptness date is. And so being able to share the information that you do know is better than sharing nothing. And that's often, in like once you're concluding an interview, like you can expect to hear by this date, or in the letters that they're sent out. None of those things are super quick, but we've seen in the different projects that we've collaborated on with other states that having clear communication with dates as much as possible is really helpful in them just feeling like, okay, I have a sense of I can wait. If I don't hear anything by, in this case, October 5th, then I should be calling and I should be worried. But up until then, it might create just a little bit more grace for hearing back from staff or from the department. I don't know, Sam, other thoughts?
No, I like that piece. And I feel like that was like such a, was a big piece from the work with the tracker of just the importance of telling the truth. And even if the truth is not what folks want to hear, that I'm going to get an answer in the next day, being able to set expectations of when things are going to be happening, and then as much as possible keeping to those expectations, I think is one of the most helpful things of not then needing additional status checks. So I don't know if that speaks to quick wins, but I would say that that is a good practice overall of just, if something's been said that you're going to get a call, making sure that that call is going through and that interview is happening, or making sure the determination is happening at the time that you said it was going to happen.
Maybe one last thing I would add in terms of like very specific to Health and Human Services and state benefits. What I've seen from different states is oftentimes, like we mentioned, the navigators, they're the front line. And some states have it where those folks that are at the registration desk aren't able to look into a case or share a lot of information where others are. And if folks are just coming in to ask, what is the status of my application? Did you receive it, or did you receive this missing document? If the person at the front desk can look that up and say yes or no, then you're cutting down the time of them sitting in a lobby and possibly waiting 3 to 4 hours to talk to a caseworker, where they really just needed to know, is this document in there? So that could be, I don't know, I guess something to think about. I've seen in certain states where they do that, where they just have less people waiting to talk to a worker when it's really not necessary.
Another question that came in is related to whether the tracker was a mobile app or mobile friendly web page or web form. So this is not a mobile app. It was a mobile friendly web page. It's essentially a portal. The MyBridges portal is accessible through the web. But good question on that. And then similarly, I think Luigi, so good to see you. Was asking about how should we think about building a tracker which requires people to log in. I keep losing the questions keeps jumping around. Oh my gosh, what's happening? Okay, versus sending proactive real-time notifications like emails or text messages. That's a great question. I think in this case, the answer is all of the above. Like, it's not an either or, it's an and. So in the MyBridges portal, there's also a robust text message capability that people can opt into. Gabby and Sam, I'd be curious for you to speak to this as well. But we've heard from residents that text messages are really helpful because they are so direct. And to your point, Luigi, you don't have to log in. But they're so short. We've heard from residents, they don't want like long information provided through text messages. They more want to know like if there's something very actionable that they need to log in and go do immediately. That's a really good use case for a text message. Often we find the two play together very well. So we can say like, you need to take action on your case. You need to renew by this date, and then have them log in. There's a link and they can log into the portal to either see more information or take that action. So the two play off of each other really well. I don't know, Sam and Gabby, what else would you say with regards to the relationship between text messages and the portal?
I think that was accurate of just like they played off of each other really well. We were side by side with this work. We were also testing around cross enrollment nudges and then also text messaging nudges specifically around the interview, and being able to reference to the tracker and pull people in there was helpful, as well as just those real-time reminders that you're speaking to, Luigi, that were very welcome, very helpful. You might have seen that you had an interview coming up in a week, and then getting that nudge the morning of was very welcome.
There's a couple questions on data. So there was a question of overall, you saw an increase in the proportion of applications. Oh, curious whether you saw an overall increase in the proportion of applications that were approved because the process was more straightforward or led to fewer errors or incorrect inputs. I don't think we were able to measure that specifically. That's a very hard, like, kind of correlation versus causation thing to be able to prove. But Gabby and Sam, was there anything that you saw there?
No, the team didn't share anything around this. I don't think they were able to dig in that deep.
Yeah. And then there was, gosh, these messages keep a question on what kind of feedback we got from staff who were typically responsible for inquiries from frontline staff. Like, did they feel that relief in calls? Was there an increase in emails or other contacts? This is a little bit tough because there's in Michigan, they've moved to what they call UCL, so it's task-based work, right? So folks who are on the call center might feel relief, but not as much felt by other people since they're focused on very specific tasks. But Sam and Gabby, what feedback did you get from frontline staff, if any, after this rolled out?
Yeah, beyond the anecdotal positive just reception, I would agree. I guess for a staff member, not necessarily like noticing maybe. Yeah, I wouldn't call out anything that they were feeling like immediate relief from it because they're still in the queue all day in the work. So yeah, I think well received, but also recognizing that there's a lot going on.
Great. There was also a question on how do customers get these messages? Is the tracker a form of an application that customers download, or is it an email? So this was actually this is a tracker that's accessible through the online benefits portal. So it is a self-service portal that Michigan has that allows people to manage all aspects of their case. So they can apply online, they can renew online, they can upload documents, they can report changes, and now they can also track their case. So once they submit an application online, they're able to track where their application is in the approval process or determination process. Hopefully they get approved. There was also a question around the role that AI played in designing the interface. Did the team think about implementing it? What were the pros and cons? To my knowledge, AI was not part of designing the interface itself.
Mm-hmm.
Yeah, that's right.
I think that's all of the questions. Are there any other? I know we have just a few more minutes, but curious if there's any other questions from the group. All right. Well, with that, is there one more?
There's one. What were some of the technical challenges you faced to pull this off?
So many. Honestly, still some of them are ongoing. So Sam, to your point, the API had to get built in order to call up the data from the back end to the front end. One of the things that I think that helped make this possible was that in Michigan at the time, they were changing the way that casework was happening from what used to be a caseworker by caseworker based system to a task based system. And it was actually the task based system that allowed us to show where cases were in the process because there were queues for work that caseworkers were part of that were, I'm conducting interviews or I'm following up on interviews and trying to get documents or I'm making a determination on a case. So my understanding, Sam, was it was that kind of task-based work that actually allowed them to have the data that was necessary for that API. And in that, it still wasn't granular enough, right? Like there was an initial launch, like the design got pulled back a little bit for the launch in order to surface what was feasible, and that they're continuing to try to make progress on different aspects of the tracker to bring increasing levels of detail that residents are looking for. Is there anything else you would add on that?
Yeah, I think just that detail piece, we heard from residents again and again, and you see it on this initial design of like, bring as much detail as you can, like for that phone interview scheduled on this date between these and these times. Like for the initial designs, they weren't able to pull in that level of detail, but they could link them to the place where they could get that detail. And so there's some of those compromises where that's what they had to work with at the beginning, but it's again, it's setting them up for that initial step to be able to go and get that information, and being able to take the key steps of really giving them a sense of the process through the tracker. Sorry, my screen was just going a little wonky there.
Mine too. So thank you all. I think that's it for today. We're going to wrap up, but we really appreciate you joining us. There are more details on this specific case study on our website. Sevilla.org/work is where you'll find all the case studies for our work that are published. And this is one of them. So if you're interested to learn more, you can find a deep dive there. We also have an online learning program called Sevilla Practica that if you are looking to train up your teams in user research or user testing or best practices in correspondence or form design, they're free, available to the public, and you can start anytime. So I would encourage you individually or as a team to check that out and see if there's any resources that might be helpful. Thank you so much and enjoy the rest of the sessions. We're glad to be here.